My name is Dr. Peter Ilves. I'm a GP in Wandsworth in London, in Roehampton. I've been using Choose and Book for about 6 to 7 years now.
I'm Nick Strong. I'm a consultant ophthalmologist at Newcastle University Trust Hospitals. I'm the trust lead for Choose and Book. I in effect use Choose and Book every day, though I don't interact with the system myself that much. My team do. I have Choose and Book letters that I have to prioritise every day and occasionally reassign patients.
Hello, I'm Dr. Steve Ollerton. I'm a GP at Skelmanthorpe Family Doctors in Huddersfield, and I am the clinical leader of Greater Huddersfield CCG. We found it very easy to implement the Choose and Book system. We had some good support from our local primary care trust at the time, and it very easily bolted onto our own clinical system, and the patient details went straight through onto the Choose and Book system. The vast majority of patients were blown away by the system. They were amazed to see the list of providers and hospitals coming up on the screen and literally showing them the screen and saying, which of these would you like to go to? You know, this is something that they'd never seen before in the medical world. So very well received, I would say.
I'm Nigel Speake. I'm a GP partner in the Manor Practice in Sutton Coldfield. I use Choose and Book every day in my consultations. Sometimes that can be several times or more per day that I'm referring patients. I tend to use the directly bookable services in my consultation, and that gives the benefits of the patients going out of the door with an appointment.
My name is Michael Doyle. I work for West London Mental Health Trust, and I've been working in the NHS now for some 23 years, 24 years. Initially for the first 15 or 16 years as a clinician, and most recently as a programme manager for a transformational clinical redesign across Hounslow, Hammersmith and Fulham and Ealing. As an organisation, we've been using Choose and Book now in Hammersmith and Fulham since July 2012.
I mean, the first thing is that the patient is able to make a live decision with their GP in the room about the referral process, where they want to go or the choices that they want to make. And at the same time, there's information available on the Choose and Book system that allows you to make that as an informed decision. Having given a patient the choice of the provider that they want to use or the service that they want to use, they can actually go away and think about it and gather more information about those services so that they're making an even fuller informed decision even outside of the consultation. I think the thing for me that I found that is of the greatest benefit, and that's because of the way that I work with my patients, is wherever I can, I actually give the appointment to the patient in the room with me, having worked through the process together. And one can develop a way of doing that quite efficiently and quite quickly, writing a good referral letter as part of the process. But at the heart of that, you know that you've worked with your patient to make the right decision for them.
The benefits of using Choose and Book are that myself as a referrer, I'm sure that the patient is sorted. The patient has got the right appointment, and I know that they're likely to go to the appointment because they've got the time and the place of their choosing. The other benefit for me is that because I search on clinical terms and because I use the consultant search as well, then I have got the best selection for that patient, and I know that they're going to be seen by who I want and in the right kind of clinic. The patients really appreciate going home with the date and the time of the appointment in their hand, and I know that that's the ideal. For me, it gives me great satisfaction as one of the doctors that actually books the appointment in consultation, and I think it does make a difference.
Some of the benefits of Choose and Book, I would say the first one is the direct booking of appointments. There is no doubt that that's one of the key benefits and the one that the patients really like. The fact that when they leave the consultation that they actually have their appointment with them and know when they're going. From a clinician's point of view, I would say it's great because I know when the patient is going to be seen and I can feel confident that that timescale is appropriate. And if that timescale isn't appropriate, then maybe I can do something about that.
I think in terms of benefits, what we've seen as a secondary care mental health provider is that we've spent a lot less time administrating referrals as they come into our services. There is a significant reduction in clinical time in both screening referrals and administration time in administrating referrals through the pathway.
Choose and Book and the e-referral system is actually a very powerful tool for a CCG to work with. The data that we have within Choose and Book around referral to our providers locally and beyond is extremely powerful and active and important. And I think CCGs can really work with that. So Choose and Book referral systems can give us a very live and accurate data set around referrals from GPs. I think the other future of Choose and Book and e-referral is increasing the usage. It's so important to do that, and I think it's so important to do that to have a consistent referral system. At the moment, as we know, we have a two-tier referral system, which is paper referrals and Choose and Book referrals. And I think it's really important to bring those referrals under one roof. It's quite difficult as a CCG to work with both referral pathways. At the same time, it's also quite difficult for our secondary care providers and our provider services to work with that as well.
When a referral is made, the trust has to capture that referral. At present, that is by printing the referral and putting it into a written set of notes. We are supposed to be moving in the next 5 years over to an electronic patient record. So this requires that we, amongst other things, capture all incoming and outgoing correspondence. Most trusts are in a position to capture outgoing correspondence, but not to capture the incoming correspondence. That is to say, both primarily the Choose and Book. So we require a utility that allows us to capture a Choose and Book or an advice and guidance conversation directly into the patient's electronic record.
I think a future of the e-referral service is getting every single provider with directly bookable slots, because it's one of the key things that patients want to see. They want to have their appointment as they leave. And unfortunately at the moment, there is a certain percentage, possibly 10 or 20% of appointments are not available. And that's frustrating. So I'd want to see all providers on there offering directly bookable appointments. I think going forward it would be useful to have the rates of hospital-acquired infections. We could have the results of the friends and family survey on there. We might even want to have like the web-based shopping channels have with direct customer feedback about, they have the star ratings about how did you find this service. I think it might be useful for patients to actually be able to see that on there and see what patients who have recently used that service actually thought about it.
I think in the future I'd like to see the electronic referral service having easier integration with the GP software and maybe with other referral support software that's now on the market. I'd like to see clearer references and easier access to the referral guidelines and pathways that we know we can embed in the system.
I think in terms of the future of Choose and Book and electronic referral for secondary care mental health, I think we have you know, almost a revolution within mental health services going on through major transformational change in terms of how we will deliver secondary care and primary care mental health services in the future. Those relationships between secondary care providers and the third sector and primary care colleagues in terms of developing health and well-being and how we interface with our local authority colleagues, all has issues, I think, for the future of electronic referral into services.